The FDA recently made it easier for people to obtain a powerful overdose-reversing medicine called naloxone. The drug, sold as Narcan, previously required a prescription, but soon will be sold over the counter. Many communities are already successfully using it to fight the tide of overdose deaths. With support from the Pulitzer Center and in collaboration with the Global Health Reporting Center, William Brangham reports from upstate New York. It's part of our series, Rural RX.
A late winter night in Cato, New York, a tiny town west of Syracuse. The crowd is cheering on the home team and point guard Julia Wilson. That's Julia's mom. On the court, Julia is cool under pressure, and not just on the court, as she proved last summer.
And my dad comes running in my room and he's like, something's happening at the neighbor's house. So I just figured he was messing with me. And so I was like, yeah, very funny. He's like, no, I'm serious. He goes, I think there's an overdose. And so I look out the window and I can see this man laying on the floor in a shed. And I can see two people trying to do CPR on him.
Many people would freeze, but Julia had learned what to do in this situation.
And so I run back into my room and I grab my Narcan kit.
Narcan is a nasal spray version of naloxone, a medication that can reverse an overdose of heroin, fentanyl, or other opioids if it's given in the first critical stretch of time.
And I get in there, and this man, he's just laying there. He's not talking, he's not responding at all. And so I checked to see if he has a pulse. He didn't. And so I grabbed one of my gloves, and I just wrapped it around the Narcan, and I just put one dose in his nose. He still wasn't breathing, so I started to perform the CPR while my dad got the other package of Narcan out. Then I stopped, and I put in the other dose.
And when he comes around and opens his eyes, what was your response?
When I seen him sit up, it was kind of just like all I could think was just, wow.
Julia learned what to do in a health class that was called Bones, Bodies, and Bandages. The class was taught then, as it is today, by Donna Capilano, or Miss Cap, as everyone calls her.
This is a skill, and kids love hands-on things. And so this is just one other avenue to keep yourself healthy or to be able to help a friend. If you know that you can do something to help somebody and you can get this skill, do it. Because otherwise you're just going to feel bad that you didn't help.
The overdose epidemic touches every part of the country, but rural areas have special challenges, like fewer providers who treat people with substance use disorders, and long wait times when people call for help after an overdose. That underscores the importance of Narcan.
That whole idea of having Narcan on you, in your purse, in your car, that's really something we stressed over the last 3 years.
Monica Salvage is the director of Healing Cayuga, the county's program to fight overdose and addiction.
Obviously, it's still important for first responders to come and to have that follow-up care. But those few minutes are really important, and it's even more critical in rural areas where it's not just a few minutes until first responders arrive there.
The push to distribute Narcan here was funded until recently by a federal study called Healing Communities, which poured money into sites in 4 states.
Hey, I'm going to check the boxes.
In Cayuga County, the Pied Piper is Wally Myers. Going door to door, Myers preaches and teaches overdose prevention to anyone who will listen.
The white tip in the nose, push the red button.
That's it?
Then you call 911. Okay? You wait 3 minutes. 911 will be on the phone with you, but you wait 3 minutes. There's 2 doses in a box. You don't administer another dose until 3 minutes.
All right.
Be cool.
You too. Stay
out of
warm
trouble.
out there.
Myers tries to make sure that government buildings and private businesses have Narcan kits on the wall. They're free, available to anyone who opens up the box. I see, so 2 of those per box.
Yep.
And when someone goes into one of the boxes, they're supposed to take
The
this
whole
whole
box,
thing.
yeah.
It's because a lot of times you need more than one.
Well, I mean, a lot of times it seems as though they don't, 2 doesn't work. 7, yeah, 7 for me. So I've been in recovery for 10 years, but sober for 6.5. So I relapsed, overdosed on fentanyl, 7 doses of Narcan to bring me back.
Haunted by demons of his own, Myers is fighting to give other people the same second chance that he got.
I sniffed 2 lines, and I stood up, and I fell over, and I bounced my head off of the nightstand, rolled in the closet. My oldest daughter found me there, all aspirated, and called 911, and basically saved my life.
When Cayuga County started this program 2 years ago, none of these boxes were on the wall. None.
None. And now there's, I think, 188 of them.
All told, Healing Cayuga has put more than 3,000 Narcan kits into the community. At least 113 people here have been revived by bystanders with Narcan. And since 2020, even as fatalities hit new highs all over the country, in this rural county, they are down by a stunning 43%. It's not just Narcan. The program encourages doctors to treat people using medications that reduce physical cravings. It's called medication-assisted therapy, or MAT.
And there is a lot of science behind that medications for opioid use disorder have really proven to be a good way to get people on the path to recovery.
Federal funding paid for a doctor who wrote the prescriptions, but that money ran out in January.
So we're, again, relying on our local providers to step in. It's hard because, places are overrun, so it's really hard to get somebody in the same day.
In downtown Auburn, in the shadow of the prison that once housed the country's first electric chair, is a place called Nick's Ride. Most weeknights, the scene in the basement is jarring, literally. They call it combat recovery. Up in front, firing them up, is a former MMA fighter named Randy Smith.
So, I can't let my guard down, right? I drop my hands, one good shot on the jaw is going to put me on the mat. Same thing in recovery.
Smith ended up here after developing a fierce addiction to painkillers. He's what they call a peer counselor, offering moral and practical support to people who are just starting their recovery.
And the mark of a true champion isn't whether you get knocked down or not, it's whether you get back up.
Afternoons find Smith in the basement with his crew, many in recovery from substance use, others just looking for a good workout.
Yes! Go work, guys, go work.
Most mornings find Smith at the local jail. He was once an inmate here.
When I was here, it was during COVID, and I had a quarantine in that cell right there for 14 or 15 days.
Now he's leading a women's support group.
We'll start with check-ins.
Nationwide, women in rural areas are more likely to die of an overdose than women in cities. Smith knows the challenge is keeping people alive long enough that they can find their way to a new path. And that takes everybody pitching in.
So I kind of just keep it right in here.
In fact, just a few months after her first save, Julia had to grab the Narcan again. This time, it was someone close to her family. And this time, they didn't make it. I'm really sorry. It's horrible. I mean, you did everything you could, possibly, and...
I've had a couple of people, I don't know if you know Wally, maybe? Mm-hmm. He's reached out, he's always checking in on me every couple of weeks. I definitely have support when I need help.
In the fall, Julia will head off to study nursing at a joint program with SUNY Upstate Medical University, lending her hand yet again to try and heal the troubled world around her. For the PBS NewsHour, I'm William Brangham in Cayuga County, New York.